I'm going to run through the practical exam format for level 3. This will also coincide with your coursework that you need for ITEC. So you begin by sitting opposite your client, talking to them about the treatment, their expectations from that treatment, and an area of tension they might have. You will then know that you can spend longer working on this area and use some of your deeper techniques like your frictions and your CTM. In your IMST manual on page 203, you have a sample treatment evidence form filled out for you. You will have the first 3 pages filled in before your exam starts. This talks about the personal information from your client, their medical history and contraindications. You're then ready to perform the postural assessment. For a female client, you would have them in a pair of shorts and a string top or sports bra. The male clients can remove their t-shirt. And the idea of this is that you can see as much as possible in that postural assessment and get clear readings from it. You're then ready to move on to your active range of movements. You can refer to your DVD for these as all those movements are demonstrated on there. Once your client is on the bed, you put them in the supine position. You will cover them with towels and go wash your hands. When you come back, you will sanitize your client's hands and feet using the wipes, and then you'll use wipes also to sanitize your own hands. You perform a full body massage routine, and you have the layout of this on page 197 in your manual. It's also giving you the timings to spend on each area, so you can practice getting these timings right and remember to leave an extra couple of minutes to work on the area of tension for your client. Your ITEC examiner will then ask you to perform pre and post-event massage. You normally spend about 5 minutes each on these, and when you're finished, you can get your client off the table, sit them back down opposite you and run through some home care advice for them. You would talk about the after effects of the treatment, the importance of drinking water, their diet, and demonstrate a stretch to use on the muscles from their area of tension that day. Throughout your exam, you will be asked some oral questions. And on page 198 or 199 in your manual here, you have a sample list of these questions. When you're asked a question, you will excuse yourself from the client, cover them over, and then answer your examiner. You're also marked on hygiene, which you can see here. So if you do have to cough or sneeze, or if you have to wipe your face throughout the exam, you would always wipe your hands afterwards before returning to your treatment. You have a list of everything you're marked on throughout the exam here from page 197 onwards in your manual. When you're finished your exam, you will be going into the theory room and you will finish filling out your treatment evidence. So what you've seen in the postural assessment, the findings from your range of movement assessment, and the last 2 pages which goes through your palpation section. This is an important area where you need to fill out what muscles you worked on, the techniques you used and how they worked, what home care advice you gave to the client that day, and the reflective practice. The reflective practice is what you have learned from doing the treatment that day. Be it positive or negative, it's everything that you've learned from that treatment.